All right, this is one of my favorite scriptures, one that when I was serving as a missionary, I would turn to quite a bit. And it reads like this, which it says, "And moreover, I would desire that ye should consider on the blessed and happy state of those that keep the commandments of God. For behold, they are blessed in all things, both temporal and spiritual. And if they hold out faithful to the end, they are received into heaven, that thereby they may dwell with God in a state of never-ending happiness. Oh, remember that these things are true, for the Lord God hath spoken it." I like that because it as we navigate through our lives and have to make decisions and with the like the heaviness and the evils that are in the world, it really gives us a guide as to know, we know what's right internally within ourselves. And as we choose the right, we will find peace, joy, and happiness here on the earth. And so just kind of want to start out with that as we dive into our week and our live stream here, Trust Implants. I give all gratitude to my Savior, Jesus Christ, as we had our a wonderful Easter weekend spent with my family, granddaughter, and my kids, my wife. How was your week, Memo? How was your weekend?
Weekend was good. I just stayed in because it rained a lot.
Yeah.
I mean, in Utah as well, it snowed, but
yeah,
kind of like we were talking about right before the stream, is this year's been a little bit colder than most years and a lot of rain. So I think for most people in Southern California, we were forced to stay in.
Yeah.
So, but it was nice. It's nice to have a relaxing time. It was a good weekend, like you said, a time to reflect for those of us who, are Christians and believe in Easter weekend. So it was good.
Yeah, awesome. All right, so we're going to dive right into it here. So we've got obviously lots of different styles of cases. I saw this patient, last week sometime as a new patient, and obviously you can see on his x-ray he's got a lot of implants, multiple systems, and multiple, over the years he's gotten these implants done. I mean, he has this implant here probably dates back to mid-80s, early 90s, just
Whoa.
by looking at the style of it. And I know that we had kind of talked about materials, and this is kind of I look at this as like a museum because he has implants from all the way back then till today. And so he has kind of the full gamut of the history of implant dentistry really is right here in his mouth. So as we look at some of the, we talk a lot on our stream here, we talk a lot about the materials, advancements in technique, in surgical technique, in prosthetic techniques, and also materials. So dental implants, the materials that they're made of today, the design, the style or design that they are today. And so if we look at some photos here. So this is one of the original implants. This is called a Corvent. And you can see it's hollow in the middle and it has some holes in it. I mean, we're talking here early 80s, maybe even late 70s, early 80s. This was developed by a guy named Gerald Nisnik, very well-renowned prosthodontist who's actually was in Calabasas, now in Las Vegas. And he had the guts to kind of develop this and stick it in. They were using beagle dogs at the time to test these out. We'd stick these in the femur of beagle dogs and rhesus monkeys at Loma Linda. And we just drill, make an incision, drill a hole, stick the implant into either the femur or an area on the beagle or the monkey and suture it up and then close it. And that's how we learned that dental implants actually, titanium, and we knew this from way back in the literature from before in orthopedic surgery, but we knew that titanium integrated with the bone, meaning that we could stick a titanium piece of metal in the bone and the bone would grow into it and adhere. So we knew that would happen. Then the question was, okay, how's that load factor? Because if you think about like pins and screws, like in my ankles, I have 5 pins from many years of doing different types of sports, And they're not really load bearing because once the bone heals, there's not a lot of load on it. But whereas if you stick a screw or a pin or an implant in the mouth and you bite down on it, there's a lot of load there, heavy load. So anyway, so as we look at the kind of the history of dental implants, so this is one of the early era age implants, and we would see these fracture quite often because of the holes that they drilled into it. But again, it was kind of the infancy of the technology, but the idea was that the holes would allow the bone to infiltrate into the implant and hold it solid. And actually it did work. And then we
Quick question. What is, from what you know, the earliest that dental implants were being placed?
So the initial implants that were studied were back in Gothenburg, Sweden, by a guy named Ingvar Brannemark, and he figured out, and he was an orthopedic surgeon. He figured out that we can stick, he made a screw that had an internal connection that you could screw a tooth onto, and then figured out that the implant would heal on the bone, and then he figured out how to screw a tooth into the implant. So, yeah, he was the founder of implant dentistry. It's Dr. Brannemark from Gothenburg, Sweden, and so that was way back in 68 or 69. I forget exactly. But in fact, here are an example of his implant. This is a little fuzzy, sorry. But and so at the time they had what was called an external hex. And we talked about this last week on our live stream. The hex is the feature that engages, because if it doesn't, it's an anti-rotational feature, so when you put the tooth or the crown on it, it doesn't turn sideways, right? So if you have a hex, it locks it into that position. So the external hex was the first Brannemark, and then actually Dr. Nisnik, he developed the internal hex, which was called the screw vent, and then he changed the anti-rotational device to go down deep inside the implant. So you have some features within the implant. So if you look at this taper right here, the benefit is twofold. One, if you sit the crown right on top of this, it's just basically sitting on top of the implant. The only engaging feature is the wall of this hex or on the screw, on the external hex. And that's why they've gone away from that. It's been a long time since they've had external hex. So, but we see them often, like on that x-ray that I showed earlier. When I go to restore his case, like I have to have all of these parts and pieces. One, I got to know what system it is, because when I take it apart and I redo his mouth, I have to have all of the connections and parts and pieces for each of these different systems. And he's got like 5 or 6 different systems in his mouth. So sometimes I feel like an investigator or something, a PI trying to figure out, a private investigator trying to figure out what is going on here. So, but anyways, yeah. So just a little bit of history on that. And then today.
So, Doctor, just going back to the history, because I think it's interesting how you have seen the evolution of implants.
Yeah.
So, because you were just showing, well, you showed the very first one, right, that was designed, and then now this other one that they moved it to. But what's been since then and then until now, right? What's kind of been 100%. The in-between that you've noticed worked and didn't work, and it's just kind of moving along in time? Yeah,
that's a great question. So here we have what are called root form implants, because there's different types of implants. In past streams, we talked about the subperiosteal implant, the blade implant. In the 70s, they did a ton of practicing on. They were trying everything. Yeah. In fact, at Loma Linda, we did a lot of research and did a lot of quote unquote practicing to try to develop something that was going to work. And we had root form implants, but they didn't work very well. They would fail, and also the connections and how the teeth would connect. That external hex was really a failure point in the system, because it just can't handle what's called a lateral load. So when you bite down, because the walls of the external hex are trying to hold that crown or whatever the prosthetic is in place, and they're only millimeters high, and as you bite sideways, it'll slip off the external hex and break the screw inside of the implant and break the crown off. So Dr. Nisnik, when he developed that internal connection, it solved that problem, because it would taper down. It's called a Morse taper down into the implant. So the ring or the top of the implant, you're getting that support here, and then you have the internal hex down below that you get support there. So it really changed the way that we were able to restore cases. We didn't have as much screw loosening and failure or fracture of prosthetics, teeth, implants, crowns, screws. The failure rate dropped significantly once we had that Morse taper. And so, and that's what we call the internal connection. And if we look at a implant for today, so this is the implant, and you'll notice the difference in the screw pitch. It's more like a wood screw, right? It's got a very aggressive thread design. It's got, this is a Nobel BioCare Tie Ultra connection. Oh, the other thing I wanted to talk about was the, real quick, so as we look at these old implants, they're very straight and square down at the bottom. In 1997, Nobel BioCare came out with what was called the Replace, and it was a tapered root form implant. So it was a more tapered system, and if you'll note, that's like this, which looks more like the root of a tooth, right? Whereas those, the other ones, you know, these didn't look like the root of a tooth at all. It looked like a screw, you know. I don't know if you can see the difference there, but so we had in 97, they came out with the tapered system. So now 90% of the implants are all tapered. Then it's a question of, one, the material, so the titanium, and being a commercially pure grade 4 titanium is really important. Not an alloy. We've talked about that ad nauseum, but, and then, so I've got nice aggressive threads here. They start to taper and become less aggressive at the crest or the top of the implant. Because imagine as you're driving this into the bone, you want to get good rigid fixation. So meaning it perches, it kind of bites into the bone, and as you drive it into the bone, it continues to get tighter and tighter as it drives down into the bone. So these are all just factors that really help us to have wonderful success with our cases. And then, so as I was talking about the internal connection, so this wall here, you'll see the hex is way down deep in the implant. So that wall, as it tapers down, is called a Morse taper. It supports the prosthetic, the abutment, the crown, whatever. And so we really don't see any screw loosening, very low screw loosening numbers with this system. And so, anyways, just probably a little too much information there, but
oh, yeah, that's definitely good, because I didn't know that implants were that that I guess young, or old? Would you say old? You say old? Because you said
1968, 69.
68, 69.
In the 60s. It actually was probably way before that, because they had to do a lot of research leading up to actually the FDA, I'm sure at that time, was very rigorous. Before they got an FDA approval, they probably did 7 to 10 years of research, making sure that, this would work.
And then going back to the Nobel implant, so that taper kind of imitates the regular tooth, right?
Yeah, the root of a natural tooth, yeah.
And how does this affect the success rate?
It really helps because, again, surgical technique is the key, and preparing the hole. So as you can imagine, so I'm going to put this screw in your mouth. I need to know the dimensions of the bone when I pull the tooth out of the socket, or if it's a healed socket, whatever the case may be, because sometimes we'll pull the tooth out if it's a failing tooth. We did this actually yesterday in the afternoon. Tooth had some issues. We pulled the tooth out, extracted it, cleaned out any infection that might be there, because patients will say, can you pull the tooth, place the implant at the same time, which is immediate placement? And absolutely, it's my preferred way to do it. But you got to know the technique on how to manage that. So you want to pull the tooth out, and then you're looking at an extraction site, so basically a hole in the bone and the gum, and then you clean that up, prepare the hole, but you have to know how to prepare it. You want to under-prepare the hole, the osteotomy or the hole where the implant's going, so that this implant will engage really nice and tight. And then you graft around any defects that might be there. So Yeah, so it's all just kind of one using proper implant materials and then proper surgical technique.
Perfect. Yeah, no, that makes sense. That actually looks nicer.
Yeah. And this one here is a zirconia implant. So it's all zirconia ceramic. So we do have implants that are actually made of zirconia. And I love zirconia implants. The only thing I don't like about them is they're really only for like one tooth here or there. They're not necessarily for a full arch because they're not as strong as the titanium. Imagine if we put in 6 zirconia implants or 1 or 2 of them broke or fractured. They just can't handle the lateral loads that the titanium implants can handle. So I only use those for single implants here or there. And the reason there is because, again, we talk about the biomechanics and the load factors. When I have natural teeth supporting the majority of the load, I'm okay with putting a zirconia implant in that area, like say the front, number 7, 10, or whatever, a lateral incisor, because it's not taking on such a heavy load, right? Whereas when I've got an all-on 6 case, the whole thing is taking a pretty heavy load, so I wouldn't dare use a zirconia implant in that case. So
is there cases where it's better to use a zirconia than the titanium?
Oh, yeah. They're like in an anterior front, like let's say you lost your front tooth, well, let's go to our TikTok.
Oh, yeah, that's a perfect one to show.
Yeah, this is a great. So, all right, so this is our, we'll kind of jump back and forth. And our internet is horrible today, so I apologize. But so here's a young lady who is putting herself out there on TikTok. And, she's a beautiful lady, but as soon as she smiles, what do you see?
It's the only thing I can see.
It's the only thing you can see, right? I think you were mentioning that there was a meme or something going around where the guy was missing one eyebrow and one tooth. And all you could see was the one tooth. You didn't even notice that he had one eyebrow. I wish I had that pulled up here, but I don't. But it's kind of remarkable that, we actually judge people by their smiles. We judge people by their teeth. It's your eyes and your teeth. It's the first thing people notice. And I'll have patients that will spend thousands and thousands of dollars on. Let me pause this. On like skin resurfacing, face lift, neck lift, brow lift. All the stuff. But they don't spend anything on their teeth, and as soon as they smile, they're like, "Oh, you kind of oversee all of that work that's been done on their face because their teeth are missing or not right." And if there's an asymmetry, like in her case on that TikTok, because there's just one asymmetry, your eye actually shifts to that void, and that's all you see. Like, she actually looks kind of like asymmetrical, or she is,
Yeah.
And so that's just human nature, unfortunately. But so maintaining your mouth, your teeth, the integrity of your teeth, the integrity of the aesthetics of your smile is a high priority. So, it's...
In her case, you would use
actually,
zirconia.
yeah. So in that case, because she has all of her teeth except for one, and zirconia is no doubt about it the best solution for her, without a doubt. So just to and if we were to fill that gap with an implant, whether it be zirconia or titanium, she would not have that issue, right? I mean, even though it's a fake tooth, it's a prosthesis, crown, whatever, and a fake, implant, it will solve that problem right away. Just that one thing, and it'll make a tremendous difference for her. But, all right. So kind of went over all the materials. Now let's look at,
I think some TikToks would be good.
Some TikToks.
What's going on in the
TikTok world?
In the digital world, as far as what people think dental implants are and the cost, and we come across videos like that all the time, so it's nice to...
Oh, absolutely. Let me show one case. Let's see. I mean, we see so many different patients throughout the week. This was last week, and if you'll notice, you see I didn't even bring these as we're talking about the history of implants, because these are actually still being used today, these type of implants, which just blows my mind. But you see how small these are? These tiny little, compared to, let's show one of my x-rays if I have one. So if we were to look at like this, I mean, these are substantially larger, significantly more, the bulk of them is a lot bigger. So this case came to me last week as a new patient. Well, you can see on the x-ray here. So these are regular implants here in the front, these two. And then on the side, you notice there's some metal shrapnel kind of up in the gum. And then these are really small here as well. So these are the mini implant that we've talked about on our live stream. And you'll notice that how long the ones in the back on the lower are here and how short these are. You see that? Mm-hmm. That's because those are broken. They're fractured off under the gum. So the implant and everything just snapped off and broke, and now it's just buried under the gum. So he came to me, because he's having a hard time finding somebody to remove these, graft everything, put in new implants. And so we are definitely going to be able to help this guy out, because it's, they had placed these. Somebody placed these because it was a different doctor, but they didn't dare go after these broken, fractured implants, which I have no problem doing that. So anyway, so these mini implants, which there's a guy named Shatkin or something. I think he runs a whole mini implant institute. There's like a big following of mini implant dentists that this is all they use is these mini implants. But I've seen so many cases like this where they fracture off. But now this guy, who knows what he spent to fix all this when he had it done, 20, 30 grand, and then have it all just break and have to redo it all. That's, and it's the selection of materials. It's the knowing the materials that you have at your disposal, knowing how to use them, and then making sure that whatever you build, you over-engineer it so that you don't end up in a situation like this, because it just adds to the one. When I go to remove this shrapnel, we'll call it, these broken implants, I have to remove bone, and then I have to regraft that bone, and I got to graft the sinus, and so it just could have been avoided had we gotten in there first. But
Doctor, have you ever placed mini implants?
Never. Well, I placed them. So the way that mini implants came about is, I've been doing this a long time, so I can go into all the history of everything. But it was called an MDI, I think, mini dental implant, and this was back in the late 90s. And so MTI, mini transitional implant. So it was a temporary. We would put them in. In fact, I do have some x-rays. We would put them in knowing that we're going to take them out. So we would put the mini implants in, put the regular implants in, because at that time we were pretty set on 6 months of healing. We didn't really deviate from that too much. And so, we wanted the patients to have some form of a prosthesis or teeth that are, as a temporary, that they could manage with, not have to be in a denture for that period of time. And so we would use these temporary implants that would attach like a denture or attach the teeth on, just as a temporary means. So that's the only time I've used them, is as knowing that I'm going to be taking them out, and I put them kind of in between regular implants. So
interesting.
Yeah.
Do you see a lot of failures for mini implants?
Yeah, I mean, I don't see too many of them, but when I do see them, they are, yes, definitely either failing or broken or something along those lines. So, all right. So, looking at, let's see, was there another case here? Oh, so here, this is a patient who is actually flying in from back east and had seen various doctors regarding his case and needs a sinus graft, and really does not want an all-on-4, because and the only reason I show this is because the only treatment that he's been to multiple locations. He wouldn't come out here from back east if he didn't feel like we were giving him something that he wasn't be able to get back there where he lives. So The only treatment option they've been giving him is removing all of his teeth for an all-on-4. And this is just another classic example of that's not necessary. I can do this without, because we want to maintain these natural teeth. They're very healthy. I actually haven't seen him in person. This x-ray was sent to me. He had sent the images over to me. But, I would want to maintain as much of this as possible and just put implants in where he's missing those teeth and not extract or remove good teeth. And so, and we've shown this patient before. This is her after, actually. So this is a case where we had to do major reconstruction of the bone. And, a lot of times patients are using what are called biphosphonates, which are Evista, Fosamax, Boniva. These are drugs that patients will use when the doctor has diagnosed them with osteopenia or osteoporosis. And there is a protocol where after 7 years, if they've been on these drugs, they can get what's called osteonecrosis of the jaw. And because the bone will start to break down because they've been on these medications. So you have to know about these medications as a patient, but also as practitioners and doctors. They need to understand the parameters with when it's safe to go ahead. And she was on biphosphonates, and we went ahead and we placed this number of implants. And completely everything, we had to regenerate the entire upper jaw. All the bone was missing there. So anyways, that's her before. Oh, let's see. Where's her after? Oh, this is the after here. So, again, it's kind of a game changer because she had been in dentures for so long, upper and lower, and then to have a permanent fixed set of teeth that she can, feel good about, smile, and be able to eat again. I mean, can you imagine wearing dentures for 20, 30 years, going out to dinner or, whatever it is, Easter dinner.
Yeah.
And just having to live with that. So once that problem is gone and solved, the dentures are gone, it really changes a lot for them.
Yeah. Well, I remember her, I think it was a few months ago, she was here when she got her set of finals. Mm. And I remember someone brought cookies.
Oh, that's right.
And we're like, here, do you want cookies?
Because she hadn't eaten a certain cookie for a long time.
For a long time. And she's like, yeah, but can you get a video of me? She gave us her phone. And it's like, here, I want to help you guys out for social media.
And she does, yeah.
And she, the video for herself of eating one of her favorite cookies. So, yeah, it's definitely, we see that happen here all the time.
And that's the rewarding side of it is, helping patients like her to kind of elevate their quality of life, I guess. There was another case that we delivered a couple of weeks ago. And, man, I cannot believe the transformation. This guy, he's probably, mid-60s. I'd have to pull his chart to see. But when he would come in originally, he just was not taking care of himself at all. Whether he'd come in, just wasn't very well kept. He just and I get it. You get to a point where just you kind of give up. But he this last time I did not even recognize him because his hair was not that long hair is an issue, but it was just not well kept. So he had his hair cut. He got his eyes done. I mean, because we finished his mouth and all of a sudden we elevated how he felt about himself. Now he's looking at other stuff. Oh wait, I want to fix this. I want to fix that. And then honestly, when he walked in, I was like, wait, is that so-and-so? And, but yeah, so it's really amazing what a really beautiful, good set of teeth or a good smile will do for people, especially if they've lived so many years without it. And having lived without it, once they get it restored, they appreciate it, and they're grateful for the chance, the opportunity really to have it back, because it's one of the only things that we can get back and have it back as normal as possible, which we talked about last week, prosthetics, and how the implant prosthesis is very much the most natural feeling and functional,
Yeah, look, feeling, functional. like you said, the things that we see, the things that they see, but then the things that are unseen, right? Like on the back end, their confidence, how they radiate that, like good energy, good frequency, how they, I don't know, I'm sure their family members recognize that, people around them. So it's the stuff that we don't usually talk about or see.
Yeah, there's a lot that we don't see, and I wish that people would kind of let it be known to those that are kind of either going through the process or need the process done, or are concerned because it is expensive, it is an investment. I don't know, I would venture to say that almost 100%. I can't think of one patient who wouldn't say it was completely worth the investment that they made for themselves, especially once it's finished. At that point, they're like, yeah, they wouldn't go back, that's for sure.
Yeah, of course. That's something we talked about, is that maybe during the process, because depending on the case, right? Yeah. But every time that it's done, they're grateful, they're so happy, they can't even remember what it was like at the beginning or in between or any of that. So yeah, definitely 100%. Yeah, I think I'm just excited to go through some TikToks.
Okay, let's get to the TikTok world. All right, let's see here. So let me pull this one up here, and my internet again is very slow, so I don't know what's going on there. So this is the one where she said she got all on 6, but she's got 4 implants on the lower. 4 is not 6, honey. I'm sorry to tell you, but it's just not. And I'd love to see the X-ray. What's that?
That's what they told her, huh?
Yeah, you got all on 6, but in the all on 4 version. So, yeah, I mean, I can imagine she's a young lady, and considering how young she is to have lost her teeth at that age, that's pretty traumatic.
Yeah.
What in the world would cause somebody, I don't know what her age is, but she's probably in her late 20s, early 30s, and I can't imagine at that age losing. I know you're not quite there yet, but losing your teeth. Can you imagine like having your teeth all pulled out?
I do quite a bit, actually, doctor.
You have like nightmares.
Well, that's one thing I think about, is because I help with like the marketing side of things, and it's like you try to put yourself in their shoes, right? And if I were to lose all my teeth today, I would be here tomorrow, and I would just figure something out to get my teeth back, because I know how important my teeth are, and especially like knowing what I know now, and just being able to eat whatever, and I was blessed or lucky, whatever we want to call it,
good genes
to have a good smile. Had braces growing up, and then also ever since I started working here, I've been flossing every day. I won't miss that. I've been rushing because
you have to.
I see, I see the struggle. But so I do imagine it. I put myself in their shoes, and that's what I tell people. I'm like, the people that do have healthy teeth,
man, like hold on to them. I'm telling you. Yeah, you don't want implants. You really don't. I mean, but when they're necessary, they are absolutely necessary.
Yeah, and that's what I was thinking about, is if anyone who had their functional set of teeth, like their functional mouth, were to lose their smile within a period of like a month or two, the entire thing, they'd get it right away.
Oh yeah, and it would be horrible. But to lose it one tooth at a time over the period of 10, 15 years, they kind of become accustomed to that situation. But you're right, if they were to lose it within a month or 2 months, they would be running.
You're like, I need it. And then that's with the ones that, over time have been losing it, like you mentioned, that's why it's harder for people to just want to commit and be like, I'm going to go in for a consultation, or I'll go get it done, or a portion of it done, is because they've spent so much time without their actual set of teeth and knowing what it's like. That's why a lot of viewers are hesitant, because we get a lot of people who, I want to get it done. I got to figure out my finances, this or that. But again, if they were to, like you always say, if you could test drive it and have it for a week,
everybody would sign up.
Yeah, you'd be here in a heartbeat, and you'd figure something out, because we see that all the time.
Definitely.
People, so.
Yeah, it's interesting because, I mean, I am very, very what do you say, like adamant about, I mean, I brush twice a day, floss once or twice a day, you know, just because of all the stuff that I see and smell. And, and so I'm really, I mean, with my own teeth, I don't want to lose one tooth. And last week I had to get a root canal. And so it was like, and it was painful. I haven't had a toothache in, I don't even remember the last time. I couldn't sleep. I was like, just like, oh my gosh, this is horrible. You know, so I was kind of feeling what my patients feel, and it's not fun. And then once I had the root canal done, in fact, I was thinking, because I took a CAT scan on myself, took an x-ray, and I'm like, man, if I need an implant, who am I even going to have do it? I was thinking, well, I could have my assistant like hold the mirror and I'll drill, like figure out a way to get this done. But fortunately, at this stage, I don't need an implant, but I did get a root canal, and the pain was relieved right away, and now it feels fine. But for a moment there, I was like, oh my gosh, this is not good. I mean, I don't know if you've ever had any tooth pain, but it's horrible.
Yeah.
It's like,
it's painful while you're having it. It's painful while you're getting treated at the dentist. So it's just try to avoid it. But here's the thing also with Dr. Willardsen is that there's quite a bit of people who are missing teeth now, but I feel from like some of the research that we've done that as time goes on, there's going to be a lot more people who are missing teeth because of the amount of sugar that is 100%. In our foods.
In our diets. Not just the sugar, but the preservatives. Our food is just filled with sugar and preservatives.
Yeah. So people have to be extra careful. They have to brush twice a day or 3 times a day to floss, because if they don't, then a lot sooner than before, they're going to lose their teeth. Yeah. They're just going to, the bone's going to start deteriorating, like you always talk about. And so, yeah, I mean, take care of it. But if not, we have the solution right here.
That's right. Yeah.
And,
it's interesting because my wife was in Italy for like 2 or 3 weeks. And in Italy, because there's not a lot of, in fact, sugar consumption is very low in most of European countries. In fact, most everywhere besides here, people just don't. I don't know how it was like how is it in Mexico? Is it like do they eat a lot of sugar? I know their food is not processed like ours. They don't have all the preservatives and.
Yeah, a lot of the times it's like it's you do. I mean, for breakfast, like we had chickens growing up, and you go get the chickens and just like
you eat natural food, right?
Yeah, as natural as you can get it, right?
Possible.
Like your own vegetables that you grow. My mom used to like to do that, and then whatever you can get at the store. So.
Yeah. And so when in Italy or in Mexico and places where they just don't even have the means to do all the food processing systems and all the preservatives like we do here in the United States, and they don't need to, because you've got chickens running around your house. You grab a chicken and you throw it in the broiler or whatever. But in Italy, you could eat all the pasta, even gelato and desserts or whatever, and not gain weight. It's the wildest thing, and it's because, one, they don't load their pastas up with sugar, and even their gelatos, they don't load it up with sugar. It's more natural and minimize on the preservatives. So, we do have to be more cautious here. I mean, diabetes and prediabetes is a huge. I mean, Ozempic right now is off the charts. It seems like everybody is taking semaglutides, and which is fine, and they curb your appetite and help you lose weight. But I don't really think they've done enough research to see what exactly is it doing to the pancreas. I mean, how is it? You take any organ, even a tooth. If you have a tooth that is not under load or under function, it's just kind of floating by itself, it's not as healthy as a tooth that's under load or under function. So you take any area of the body and you take the stress off of it, whether it's your muscles, whether it's your pancreas, whether it's in your kidneys, whatever. Our bodies like to be under load. They like that stress, and because we have that counterbalance, right? We balance back the force that's put on us. So if you eliminate that from the pancreas, how is that affecting the pancreas? Does it cause atrophy or shrinkage? Anyways, I don't know all the science behind it, but yeah, Ozempic is a big.
Yeah, but you're onto something, doctor, because that makes sense. Like what you're saying is, it's got
to be balanced, right?
Yeah. Yeah.
And I'm a fan of the semi-glutides. You know, especially I think what it does is it changes your relationship with food. Because your appetite is so suppressed with Ozempic or Wegovy or whatever semi-glutide that the person's taken, your appetite gets really suppressed. In fact, you get to the point where, I don't know, like for me, like unfortunately, food motivates me a lot of times. You know, it's like I get up in the morning, like, oh, what am I going to eat? Or I go home, it's like, what are we going to eat? You know, it's like, but when your appetite is so suppressed, that feeling is not there anymore because you don't even want to eat. Like it makes you nauseous, and you don't feel like, you know, in fact, eating almost doesn't sound good because you're so nauseous, and you feel full all the time. So people are losing a ton of weight with semi-glutides. Yeah. And you know, which is, I mean, again, I think it's great, but I really do think there needs to be moderation. But once you start Ozempic, you pretty much have to stay on it if you want to maintain that weight. As soon as you come off the Ozempic and start, you know, back to your old lifestyle, the weight will come back on. But
yeah. So, doctor, as far as the diet, because we've been talking a little bit about the diet, what's a healthy diet for someone who just got dental implants? What, can they eat anything or?
Yeah, they can eat anything.
And then as far as sugars, because they don't really have real teeth, so they can.
Yeah, I mean, sugar. The issue with sugar is that, so like any organ, whether it's natural dentition or teeth or dental implants or our extremities, if you see a diabetic, had a patient yesterday who's diabetic, and he's got a major ulcer on his foot that will not heal. And the reason for that is because the blood supply, or the vascularity of the blood in his extremities, so his feet and his hands, especially the feet, is very affected by the diabetes. So they'll develop these ulcers and wounds that just don't heal. Like, you have to have blood and good proper blood flow and blood supply in order for maintenance and support. So if for example, I'll do a surgery on a patient. If they're diabetic, make the incision, and right away I know, because if there's no blood there, I'm like, oh man, you know. Fortunately, I have a lot of other things that I can use to kind of mask that. We use PRP, we use different guided bone regeneration materials in order to mask the fact that the blood supply is inhibited. So, I mean, yeah, I diverge all the time. But the blood supply is very important. So if somebody's eating a lot of sugar and they're pre-diabetic, or they become diabetic, or, you know, they just aren't healthy, their healing properties are going to be suppressed. And so if they've spent, you know, however much on a full mouth dental implant reconstruction, then go back into those old lifestyles, and their blood sugars are all over the place or off the charts, they're at risk because the blood supply is affected. They're at risk at losing the whole case, you know, because implants got to have blood supply. The tissues, the bone needs that blood supply in order to support itself and maintain itself.
And that's the stuff that it's unseen, that we don't, because to me, like, I have no idea. I'm like, what I'm thinking is you eat sugar, it messes up with your actual teeth, right? Yeah. But
this is more of an overall systemic effect. It's affecting your feet, your toes, your teeth, your mouth, your tongue. Like, their tongue would have like a metallic taste because it just does not have that same blood supply. We see it. We'll see like a very dry mouth, or on the tongue. A diabetic tongue will look different than like yours or mine.
So it affects
everything,
the entire body. I didn't know that.
Yeah, and so.
Interesting.
All right, let's see. Should we go back to our TikToks? Yeah. So we just kind of pull random TikToks around here, just for entertainment purposes, but.
Some interesting ones. What is going on there, Dr. Bush? What are they showing us?
So, well, what is going on here? So let me see if I can pause it here, right there. So if we look at this, this ad for 10% off, this is a patient who had a bridge and had some root canals on these. These are just rotted teeth. And looking at her gum tissue, I'm trying to decide. I look at like her lips and the tissues around her teeth. She's probably diabetic, I would imagine, or at least pre-diabetic. And so again, all of this will fail 100%. I mean, a lot of it has to do with the dentistry that happened. Like you've got these, so what's happening here is this is a bridge, and then underneath that bridge, there's some really nasty, decayed, rotten teeth. And then eventually when she bites down, those teeth kind of snap off or give way, and then the bridge falls out. So these roots or these teeth need to be removed, and then this whole case has to be like evaluated, and not at a discount. I mean, if this patient wants to have something done correctly, they're going to have somebody that can look at the whole case and methodically come up with a plan. So I was going to try to grab that. There we go, right? That x-ray, because I wanted to see it myself. There it is.
Yeah, some of these cases are just Band-Aids, huh, doctor?
Yeah, it's a Band-Aid for sure. So she's got a partial. So this is a partial that comes in and out. This is the bridge that they're showing on their ad. But, when I look at this case, I'm thinking, okay, we got to get rid of the partial. We got to get the biomechanics back in place. We need the aesthetics. Like there's so many things that need to happen here. To focus only on this area or that bridge is not doing the patient a whole lot. It's kind of a disservice because eventually she's going to be back in fixing other stuff, and you don't have control over the way it looks, the color, the shape. Imagine if we just did, for example, if we only did these 3 teeth, and that's it. When she came in, the bridge is loose. Oh, we're just going to replace those. So I do all this work. I extract the teeth, bone graft, implant, and then make the final set of teeth. And I've got all of this kind of garbage around it that, I don't want to match my new set of teeth to this. So I would be very much adamant about, I need to reconstruct this case, but that's just kind of, my angle on these sort of things. But needs to be fully looked at, and she would save actually a ton of money if she just had somebody go in and just do the whole thing. So, but
yeah, it's sad. It's sad that these people are posting these cases all over TikTok, and we always talk about the failed cases here, and we think we only see them here, but thanks to TikTok, they're all over.
Yeah.
And that's we always keep saying that. That's the purpose of this live stream. Of all of Trust Implants is to educate patients. I know the big implant centers are not happy with us because of what we're doing, but we're not doing anything wrong.
I'm only speaking the truth. So
we are, yeah. We're just
not. That's all I'm doing is just telling the truth.
Yeah, and which is what people need, right? And that's the thing is we let the people decide, and everyone who watches our content, watches these videos, join the live streams. Or like our sales reps, right? They're on the phone with them and just explaining to someone who's looked into all-on-4 the difference between that and all-on-6. To them, it's a no-brainer. And these are patients that don't know as much as you do. I don't want to say I know more, but I've been in the industry for some time. Yeah. So to me, it's like a no-brainer. But even to someone who just had it.
It's... I'm just going to keep doing, we are going to keep doing what we're doing. I'm not going to change my, I really don't care the hate that I get on all the social media channels and from these big venture businesses. I just don't care. They'll have to do something extreme to shut me up. That's, I don't know. But because, we're attacking we're attacking a system. Mm-hmm. We're not just, and that system is such a big system that there's a lot of forces against my message because there's so much power and force within that system. And so I'm just one guy. I know what I know. I do what I do. And I feel very, very good about it. And I have patients that will stand behind everything that I do and say. But, again, it is a system that there's a lot of money behind it, and money has a lot of power.
Yeah, and like you said, we're here to educate, help patients or potential patients that are looking into in the future, and we'll be here every Thursday, same time.
Exactly. I think we've got one more TikTok. And let's see. I don't know why my computer's glitching out so much, but so I think we've shown her before. She had a couple of teeth. Again, young lady. And to have had those teeth removed at such a young age, so we can see she's missing all these teeth here. So this is a great example of, we've got perfectly healthy teeth. And I don't know if you can see that, but she's missing her 2 bicuspids and her molar. So she's missing the equivalent of 3 teeth. She's young. The rest of her teeth seem to be healthy. I don't know. I obviously haven't seen an X-ray, but if she stays like this, if she just leaves it and does nothing, I mean, she's getting implants obviously, but if she were to just leave it and not restore those teeth, eventually everything else is gonna fall apart too. Just because of, again, I talk about it too much, but just how the mechanics work and how the mouth works. If now all of a sudden all the pressure is on the left-hand side, on her left, when she chews and eats, and it's going to be there indefinitely until she gets those teeth replaced. So if she leaves it like that, she's only going to be chewing on the left side. And so, yeah, I mean, it's and she's pretty young, it certainly is something that, she's smart to replace those teeth with dental implants. So, all right. So, let's see. Last thing, and then we'll wrap it up here. But I had a patient yesterday who he comes in. He's like, "Man, you look refreshed. You look like you're like you're not as tired." Because I guess the last time I saw him, he said that I looked really tired, which I probably did. But the reason is because here we're implementing RF microneedling and some aesthetic procedures, and truly this machine, the Silfirm X, which is RF microneedling, which what it does is it introduces radio frequency needles into the tissue, which helps stimulate collagen, which ultimately helps regenerate the tissues. And so you can take this machine, you can go under the eyes, you can go over the eyelids, everywhere on the face. And I noticed a significant improvement just with one treatment, and you need like 3 treatments. So, here's the device being used, and it's just it's a grid matrix that you just go along, and you're penetrating the tissue, and so blood flow will start to come back. And then after we go over the entire face, under eyes and around the eyes, the neck, after we go over the entire face and neck, we'll put exosomes or platelet-rich plasma over the top of it, which helps the tissues and the collagen formation even more. So, yeah, I mean, it's pretty exciting because we want to look, and we have an app on Repeat MD, and we are concerned with facial aesthetics, right? When we do a case, when we do a case like this and we get a result, like this, now I'm like, okay, what else can we do? Because I mean, she's beautiful as it is, but I want to maximize our results. I want to maximize our efforts. And this is just one more tool in our armamentarium that we can use in order to really maximize the overall facial aesthetic. And I mean, it's really exciting, and it's fairly new technology. The Silfirm X was developed and brought to market in the U.S. in 2020. So it's it's not new tech. Well, this machine is new, and it has what's called the gnaw effect, and that's just how the energy is distributed throughout the needle. And so that's fairly new technology, and I'm really excited for my patients to be able to offer this to them and give them that service.
Well, like you mentioned, is once they have the teeth, is like they're excited to do their skin, any of the extra stuff. And then, by the way, I was here when you got treated, and I was talking to the girls in the front, and we thought you were going to come out glowing red. and it didn't. Like, you came out like nothing had happened.
I was very impressed. And, you know, of course, you're literally poking needles in your skin, so it was bleeding during that time. But that's the perfect time to put the exosomes down or the PRP, you know, and that will just infiltrate into the tissue to help form and stimulate collagen. So it's remarkable. And, you know, last thing I'm going to do is go get a BLEF or any sort of surgical, like a facelift or anything. I don't think I would do that at this stage, but I would do this because it's good maintenance. You know, it's good. Mm-hmm. It was not painful, and I noticed a result, you know, even it's been a week now. And so, so I'm excited to offer this to all of our patients that are interested. And so, all right. Well, I think we've come to the end here, and we really appreciate all of our viewers. And go ahead and hit that subscribe and like button. And stay tuned next week. We'll put together another show for you guys, and also comment, ask questions, post x-rays. If you have any issues with your teeth, with anything along the lines of your aesthetic, go ahead and ask questions there, or you can DM us as well. I'm Dr. John Willardsen. I'm here with Memo Hea, Trust Implants, trustimplants.com, and we'll see you next week.